Good afternoon, and welcome to the first virtual OAFP Wellness Week. Today's theme is Finding and Renewing Your Why. I'm Dr. Kelly Meehan Delacruz, OAF speaker and member of the Joy of Medicine resource team. Joining me is Dr. Javidya Dasarathi, Northeast Region Director and also a member of the Joy of Medicine resource team. We're happy to be with you today. In an effort to support members during this time of transition, the OFP is leaning into its strategic priority to bring joy to I'm going to start over with that, to bring joy back to family medicine and providing a week full of wellness delivered directly to each member. Throughout this week, members will receive daily resources and information on wellness themes. Hopefully you received one this morning. You choose how to interact. You can engage in content immediately or revisit when you have time and space to do so. For today's live session, we're taking a unique twist on today's theme of finding your why. We feel that an area that may help you renew your why is building connections in the community. How are you and your team connecting with patients with community resources? While an extra area of care to consider, connecting patients to the non-medical resources they can improve joy in what we do. To help us dive a little deeper, we wanted to invite family physician Dr. Kim Yu to join us to share resources and information on making vital connections with the community. Dr. Yu is Regional Medical Director, Growth Partnerships at Aledade and a Wellness Ambassador with the AAFP's Physician Health First Initiative. You can find her on Twitter at KimUMD. Dr. Dasarathi and I will also chime in from time to time to share our own stories and connections. And as you listen along, please feel free to share any questions in the comment section under this video, wherever you're watching. Also, please include your comments or your own best practices. We'd love to see them. Use this space to connect and share with each other. With that, Dr. Yu, take it away.
Thank you so much, Dr. Delacruz, and thank you to the OAFP for inviting me here today to talk to you about finding and renewing your why, building community connections. There's joy in that. Sometimes, and I've been thinking, especially this past year, it's been really difficult and challenging as to how to find joy, especially because of COVID and the pandemic. And so as we go through the next half hour, 45 minutes or so, I really hope that we'll be able to share some time and some space together to be able to really reach that point of understanding and really the journey as to how do we get to that joy? How do we get to the why, finding our why again? Next slide. So our agenda, we're going to talk about building community connections, what it's like to really have joy in leadership and advocacy, talk a little bit about resiliency, finding your Ikigai, and lessons learned this past year. Here's my why, and you can see photographs of not only my family, my children, but also my community. Physician Moms in Family Medicine is a Facebook group of family physician women from around the country, actually around the world. There's over 3,000 of us now, and I started that group several years ago. And so along with knowing the work that I'm doing in Aledade and with community health centers and primary care practices around the country, working with Wonka, you can see that heart-shaped there where we were doing the International Family Medicine sign, a Wonka sign. It's really been wonderful to be able to spend some time to really sit and think, well, what is my why and why am I doing it? Why do I spend time, with the academy or with Wonka or with Aledade, doing the work that I do every day when I could be home with my children who are now much older than they were in these photographs. When we think of community engagement, there are several different things, and you may be already doing many of these things already, whether you're connecting patients with local resources or connecting with local organizations yourself, your staff, your practice, connecting with local officials, connecting with other family physicians or other organizations and physicians through whether it's OAFP, AFP, the member interest groups, or other groups like the AMA or NMA. Or maybe you may have organized a coalition. All of these different ways of engaging with the community can help inspire and trigger the reasons of why did you get into medicine in the first place? What is it that we're really doing here? I wanted to share this resource with you. It's from the Everyone Project and part of the Health Equity Toolkit on how to be the physician advocate. And so please do go to this website and part of the AFP Toolkit that is available to you as AFP members. It really is a very good resource and will have different things that you can look at to engage with your community. So, what is advocacy and why really should we do it and how can we do it? When we look at the different definitions on the next slide, it actually will show you the reasons why we actually do advocacy and what it really means. Advocacy for health equity is really the deliberate attempt to influence decision makers and other stakeholders to support or implement policies that contribute to improving health equity using evidence. If you look at another one about being a health advocate, being able to contribute your expertise and influence as you work in communities or patient populations to improve health, when you think about that, that's an incredible, incredible privilege that we as physicians have to be able to influence health on such a large scale. Many of you may have practices of 2, maybe 3,000 patients, maybe even larger, 5,000, 10,000 patients, depending on whether you're in a solo practice or a large community health center, or you're hospitalists, or you're a researcher, you're a family medicine preceptor. Wherever you are, you're building connections with your community, and it's in those roles where you can advocate and see the bigger picture of your reach in that community. I was thinking a little bit about previous crises. And when I was president for the Michigan Academy of Family Physicians, I remember we had this crisis in Flint Water. And here's Dr. Mona Atisha, who was pivotal, her work and advocacy in highlighting and shining the light on, what was happening in Flint. And, what we were able to do as family physicians during that time was really advocate for changes in the system. You can see on the next slide a picture of many of us gathering at our advocacy day. And we're actually being given a round of applause by a physician who's a family physician in the brown suit there in the little aisleway of the Congress that was there. Who was actually saying thank you. These are times right now where maybe last year we heard a lot of thank yous. This year you may not be hearing very many thank yous. You may be hearing a lot of negativity. You may be hearing a lot of, well, it's your fault, or it's, you're not giving me this medicine that I want, or whatever it might be. It's become more and more difficult and more challenging to do advocacy. And we definitely don't do advocacy like this, where we're actually able to go to the steps and halls of Congress or the Hill the way that we used to. So what about now during COVID? A lot of us are doing vaccinations or trying to, and helping with debunking myths, assisting in vaccination clinics or rollouts of that. You may be in your current work and assistance working heavily with different programs and community organizations to be able to deliver care and be able to provide the resources for your community in terms of education of the public at your school board, or whether it's with your legislators, or whether just with your patients. Research and assisting in research, maybe you're participating in one of the actual, vaccine trials. And then role modeling and showing and staying safe during this time is really hugely important when we wear masks in the community or where we talk about vaccines. That really is such an amplification of our role in public health. And so connecting patients to resources and being part of campaigns like the This Is Our Shot campaign, you may have heard about that, which is a national campaign to help healthcare heroes really build and amplify the need for COVID vaccination, to debunk those myths and to really help the public understand the reason why we need to get vaccinations. Being part of these types of campaigns can be very pivotal and really very fulfilling. I will say that, I've been involved in the This Is Our Shot campaign for many, many months now. And in the beginning was more involved in the actual allies part of it. So building relationships with partnerships and organizations so that we could have nurses and pharmacists talk with us alongside family doctors and internists and pediatricians and OBGYN and everyone, that we all stand together and talk about COVID vaccination on the same level. And so I'd like to talk about Dr. Abraham. He won the Healthcare Hero Award from the California Academy of Family Physicians because of his work at Kedron in LA and South LA, Los Angeles, and where he's delivered hundreds of thousands of vaccines to the community and even been invited to speak at the Capitol in DC on behalf of physicians and his health center, on behalf of his community, to say we need vaccinations, we need PPE, and all of these things that we advocate for. This quote that he has, advocacy should be an essential activity of every physician's portfolio of work. And while the demands on physicians continue to mount now more than ever, physicians making their voices heard in the halls of government is essential. It's critical that our policymakers hear directly from us about the issues that matter to our patients and making a difference in improving health for our society. Can you believe that this quote was actually from about 4 years ago? It's the same right now, right? To this day. And so it's really exciting to see the work that he's doing, but that he's continuing to do. You can see the joy on his face. And it's been an absolute, privilege to be able to, an honor to really witness what he's been able to do. It's really inspiring. Other ways that family doctors around the world have helped advance health equity and also just community health, sharing these stories from around the world. That's what we can do as family physicians. We can share our stories. So whether it's giving masks and PPE to people that need it, or doing patient education via social media, doing testing and addressing racism, all of these things really are advocacy and action and play a huge role in what we can do as family physicians. Here's Dr. Martinez Bianchi, Viviana Martinez Bianchi from North Carolina. She started Latin 19, which was a collective response for the Latinx community in North Carolina, and working with, as you can see, many different organizations, connecting everyone together. If you imagine that she's been able to convene on a weekly basis, every week on a Wednesday at noon, all these different organizations. And because of that work, she's been able to vaccinate thousands of people, provide PPE, provide patient education information in Spanish to the communities that need most. Really amazing work. Because of that, she's been able to even influence policy. And I can't tell you how excited she was when she told me about this. And, we were really so thrilled that they were able to really work on being able to get vaccinations to the patients where they needed it most. In her community, she noticed that where the vaccines were being distributed were not in the Latinx communities. She was able to actually go and say to HHS, this is where we need to get vaccines done. You're not going to where the patients are. And so we need to be able to stand up and, take notice and be able to say what we need to say to be able to reach the communities in need, especially during these times. What about in Ohio? Dr. Mike Sevilla, for many years, has been a strong advocate and leader, not only right now as president for the Ohio Academy, but in his work on the news, in radio stations, in his blog posts and podcasts, all the work that he's doing is incredible to be able to engage with his community, to be able to bring right now, I think this was the most recent one, right, Dr. Delacruz, where he talked about heat stroke. And I don't know what the temperature's like in Ohio right now. In California, I think it's 90 today.
That was just, I think, day before yesterday that it was done.
It's incredible work. And I just love the way that Dr. Savilla is really able to engage with communities through media, right? Whether it's on the radio or news, TV, social media, using all the different avenues to be able to engage and reach his community. How about you, Dr. De La Cruz? Tell us a little bit about these photographs.
So I live in a pretty rural county in Ohio, in Huron County, and my wife retired from her job as executive director of our Chamber of Commerce. She was very well known in the community and just has a passion for lifting our community up. So over the past 3 years, she has run twice for county commissioner with my help as an assistant campaign manager and with our daughter's help as a co-assistant campaign manager. Our daughter actually would get on to Facebook Live and do broadcasts for her. So that's the first picture with James for commissioner. And then the other picture is of me with the best dog in the whole wide world. That's Duke. He is a livestock guardian dog on our farm. We have several livestock guardian dogs, and they guard our goats, which we use to produce meat. Goat meat is actually the most consumed meat on earth. We just don't produce very much in the United States. And we don't meet the need in the United States for communities of diverse cultural backgrounds. So we decided that that's what we would do. We also have more than the 6 chickens that I asked for by 10-fold, really. And so now we have a plethora of eggs, and we have over the past 4 years developed a network of food pantries to which we donate the eggs.
That's amazing.
Kind of a small way that fits into our lifestyle to be part of our community and find meaning.
I love it. I love that so much. And I know that Dr. Mary Krebs Grumbeck also has a farm, I believe, with sheep. I believe she has goats and chickens as well, that she also shares her produce from that farm. Here I have an example also of Dr. Grumbeck with Dr. Krebs with the work that she did with AFP last year, and when she actually contracted COVID but was able to share her story. And so you may be going through things right now where you may think, how could I really impact my community? I'm not really sure. And this is a photograph of a bus in Orange County. And I remember being behind this bus and reading it. And I don't know if you can see, it's pretty small, but it actually says there are 26,000 homeless children in Orange County. Let that sit in. I remember seeing this and just, I began to bawl. I started crying. I had 2 kids in the back of the car and they were like, "Mom, what's going on? Why are you crying?" I was like, "Look at that sign." And we knew, coming from Michigan to California, I was like, we're living in Orange County and it has a reputation for being, almost like Hollywood. We've got the beach cities, we've got Laguna Beach down the street. And I mean, it's just a very different lifestyle. And yet we have 26,000 homeless children. So what can we do? And so you may be in your community just randomly going about your business and you'll see something. And you'll realize that maybe that's something that you could do something about. So we need to find our community, whether it's local, like in a lane, in your community and you see something, or nationally. Maybe it's something around the country, or maybe it's internationally. And so I'm really excited to talk to Dr. Dasarathi You have done some amazing work too, both local, nationally, and internationally. Could you share a little bit about that?
Yeah, sure. Unlike Dr. Delacruz and Dr. Krebs, I live in an urban community in Cleveland. So, when we had this lead poisoning crisis in our Cleveland community, I got connected to the local community, the Clark Fulton Community Connections. They have a separate Facebook group. So you can connect them through the Facebook group, and they invite me to share my thoughts about lead poisoning and the consequences on the children. So the whole community itself, they were focusing on building a health pilot to solve the lead poison in our community. And then you can see that the pictures in the top, that the children, who were visiting us, in the community, the satellite that I work in. And below, there is a picture there, through that community leader, I got connected through another nonprofit organization called Squashin Education Alliance. This education alliance, served through Zoom to educate the population to bring the values of diversity, equity, and inclusion. So I was in the COVID vaccination info session call with the number of people from the whole community in the nation, where I was when the vaccine came out in March in 2000. 6 months ago. Everyone was freaking out, so I was able to get in and answer some of the clarifications and questions.
That's
And another
wonderful.
diagram you can see in the international community that I worked in when Zika was a public health crisis. I went to Managua, Nicaragua. So we developed a community project to reach out to the community using a community health worker. So I connected with a nonprofit called Amos Health and Hope, which is located over in Managua. So it was a really pleasant experience and eye-opening experience, to travel to the country to learn from those cultures.
It's fantastic, incredible work, and just so fulfilling, right? I'm sure that when you're doing this work, it must have been
It's so
impactful on
meaningful to
your
be a family physician, what impact you can bring through, your work and your experience to the community.
right, right. Incredible. Thank you. So there are some resources, and this is Health Landscape, which is a product that is developed by the AFP, and so you can put in your zip code and your city, and it actually evaluate from a population health standpoint, what does your population and community look like around you? Incredibly helpful information, not only on unhealthy behaviors, but health outcomes and prevention, rates of mammograms, rates of how many percentage of family physicians or primary care physicians in your community, what is the rate of people's sleep, like how many people sleep 7 hours a day, or percentage of people without teeth is always one that strikes me as really kind of eye-opening, because there'll be some communities where it'll be like 20-30% of the population don't have teeth, and you can imagine how that would impact one's diet. And so, really helpful information. I encourage everyone to look at this and to help you, inform you, so that you're able to look at different programs that you may want to put forward in your practice. This is another thing, using geo hotspot mapping and other tools. And so this is the Community Health Center Association of Mississippi and Aledade had a collaborative to look at their Medicaid patients and decide, well, what is it that we can do to really help them, especially during this year, during COVID? And so they actually deployed mobile units to where patients hadn't had preventive care visits using geo hotspot mapping, like where are the patients who haven't had preventive visits, and going to those places and really putting mobile van units and getting mammogram events or community events in those areas to get preventive care increases. They also deployed flyers with different services that were available for families and children in 30,000 kids' backpacks. Now, I'm just glad that I wasn't the person that was stuffing those backpacks. But if you imagine 38 schools getting these backpacks, getting these flyers into the backpacks, doing follow-up work, they sent 20,000 postcards, sent lots of text messages, using technology to help you to engage with your community. And they saw an increase in primary care by over 100%, 106%, even with COVID. Incredible work and things that you can do to engage with the community. And they were so excited. I can't tell you how excited the field team was to be able to do this work and also see the results. Using Neighborhood Navigator, it's run through Aunt Bertha and other programs that really provide resources, again, by zip level that you can share with your patients, is a good way of being able to find resources on the fly, and also building. I always tell people, build a sort of like several page document of what are the resources that you know you will need for certain patients in your community, and have that so that it's easily available for you when you're working in your practice, because even just being able to do that can bring you joy when you know that you have a food pantry, or you have a certain dentist that takes that has free care or reduced cost. It can be a huge help to your patients and make you feel like you're providing something for them, when oftentimes it feels like we can't do enough. So, I've been bit by many of these mosquitoes, and sometimes we can feel like we're too small to be effective. And so, what I like to say is, use the tools that help you amplify. And so, social media, in the next slide, is something that you can do. And so this is, we have several social media stars in Ohio, one of them being Dr. Sevilla, who I think is on right now. So hi, Mike. And here's some of his Facebook tweets and, things that he's put out. But it just, if you think of it, if you're able to share a tweet, if you're able to share a Facebook message, if you're one of these people who likes to do TikTok, I am not one of these people, but you could share and engage with the community in a much different way. And here you can see a post that's actually someone who was really creative and got pictures of all the doctors and made this sort of Rosie the Riveter poster, for This Is Our Shot. And then on the right hand side, this is actually a video of our former presidents with the This Is Our Shot campaign, the ad council doing that ad. And it was incredible, the work that's been done for this campaign. When you think about it, we're all volunteers. None of us are paid to do this. And yet just one tweet at a time, just one message at a time, just one post at a time, we're able to have over 1 billion impressions. So you can say that, the little mosquito that was, like, we are able to affect and implement change in many different ways. And using the tools that are available, you could just once a week, if you are able to share a message with your community, that would be incredible. But we can sometimes feel like this. You ever feel like this? You're like a whack-a-mole, like you're either the person, you are the mole being whacked on the head, or you're the person that's doing this, trying to put out all the fires, right? And we just want to crawl back into the hole and just hide. And it can feel like that, especially during this year. This year has been just brutal. And the moral injury that many have suffered has really led us to really have the highest levels of burnout that I've ever seen and witnessed, not only for myself, but for others that I care for. And so I wanted to share this resource with you. It's the Provider Resilience app. I don't get anything from it. It's a free resource in the App Store. You can do the Maslach Burnout Inventory or the Mini Z. There's the Mayo Index that the OAFP and AFP have provided that's free of charge. And you can also use that resource. I really like this Provider Resilience phone app because it actually will give you a number that can change depending on how you feel and where you put in what your compassion fatigue level is, or when was your last vacation, and how you're feeling, and all the different things for burnout. Like, you can just put them in there. It's kind of a really neat tool. I wanted to share also with you what I learned from previous crises, from Hurricane Maria. And so Hurricane Maria was 4 years ago, which I can't believe it was that long ago. But Hurricane Maria happened, and I remember thinking to myself, well, all my friends in Puerto Rico, how are they doing? And what can we do? And so with the Indiana Academy of Family Physicians and many chapters, including Ohio and many others, who donated money, we were able to raise $110,000 and buy 66 generators, get medication, supplies, food, water. We sent over planes. We sent several tons worth of medication, food, water, and supplies to Puerto Rico. And we worked with the physicians, the family physicians, and other physicians on the island to get all of this. So all of these generators, food, water, you imagine we had Jeep brigades going around the whole island, like going to the airport and picking up the stuff and then bringing it to where they needed to go. These were all family physicians, medical students and residents helping with all of this program, but they needed sort of people to help with all of that. And so this took about 6 to 8 months of my life. In many ways, I was working part-time at the time, but it was really a lot of work. It was hard work. I talked to Tesla. I talked to the equivalent of FQHCs on the island and trying to get solar panels for them. We got food and water for the nuns in the convents and to the orphanages, and ensuring that our generators went to the right place and weren't stolen. I mean, there were so many different facets of this campaign that really took a lot of effort and hard work. And it was very draining, honestly, at the end of it. I was really tired at the end of it. And I remember sitting there thinking, I need time to heal. And right now, I feel like we need time to heal. We've been at this now for over a year and a half, it feels like, and we need time to heal. This is where I went. I went to Hawaii, and maybe right now you may want to go to Hawaii, but it may not be a good thing to go there right now because rates are going up. Delta's there. But I remember going to Hawaii and thinking, it's going to be great. I'm going to go to Hawaii. It's going to be wonderful. And guess what happened? Another hurricane happened while I was in Hawaii when I was trying to get away from like all of that I'd been doing, right? And so it can be that you're trying to take time to heal right now. But there's another hurricane coming, and we have Delta here. And it may be the next thing, right? The next hurricane that's on the horizon. And we need that Hawaiian survival handbook. Whatever it is, we need to have that handbook to help us survive. So I like to talk about spending time to, find time to heal by filling your bucket. And many of you might have read that children's book about filling your bucket and how do you fill somebody else's bucket and all of that. And I'm not going to talk about that right now, but I do want to share another book that I love, The Boy, the Mole. You see a theme here with the moles, right? The Boy, the Mole, the Fox, and the Horse. And I love this quote from that book where it says, this storm is real. If you don't have this book, get this book. It is just wonderful. It's full of graphic art and little phrases. But it says, this storm is real and our fear is real, said the horse. But our love is real, and in the end, love wins. We know that right now, fear is rampant. But we know that our love for our patients and our love for our families and our love really for ourselves too, right? We need to love ourselves, that love does win. And so remember that as you spend time to heal. This is how I spend my time to heal, is also by connecting with the world of family doctors, whether they're here in this country, here in Ohio, or whether it's internationally. So this is a group of our health equity team doing a webinar for WONCA, the World Organization of Family Doctors. And because you are a member of the AAFP, the OAFP, you can be a member of WONCA, and it is free. So please do remember that there is a world of family physicians out there. And you can share your expertise with them and build connections and relationships that really do help you see the world in a different way. I like this quote, this little snippet from Family Practice Management. It's from a few years ago, but how to find joy in medicine one day at a time. And it says to avoid burnout as a busy family physician, it's important to remind yourself each day of your mission and what brings you joy. Developing strong relationships with the right team of physicians and staff can make your day so much better. And as part of a huddle at the end of the day, Barbara Stanford from Michigan, found it helpful to ask, "What joy did you find in family medicine today?" And she writes, "The discussion that follows helps us remember why we are here." Why are we here? Well, let's think about that a little bit more. I want you to think about your reason for being, your Ikigai. And that's a Japanese term that really means, your reason for being, the reason why you get out of bed every morning. And it's really the intersection of your passion, your mission, your vocation, your profession, what you love, what you're good at, what the world needs, and also what you can be paid for. So that Ikigai is your red spot. It's where you need to be. But for many of you right now, you may not feel like you're at your red spot. I'm so going to encourage you to get a piece of paper out and really write down your mission, what you're good at, your vision, your red spot, where you need to be, and what steps you need to take to get to that red spot. Because it might be engaging with your community, but it's also because of this. The Mayo Clinic model really has shown that decreasing burnout through increased control, community, and shared values, those three things. So increased control. Right now, we don't feel like we have much control over things, right? But we can work on community, and we definitely have shared values, right? So in terms of community and shared values, we could definitely work on those. We can try and have more control, especially at work where it might be. But when they did these things that you see listed here, you could see the morale increase 17%. They had 12% increased teamwork, and 50% had an increase in satisfaction or engagement at work. That's really incredible. So where are we now? I would encourage each of you to write. If this is your thing, and I know that several of you may be writers or maybe creatives, it may be that you like to knit or sew or whatever it is, or draw, whatever art that you may want to do. This is an article I just wrote on COVID-19. You can see the QR code there and the link. But I really wanted to share this phrase where it's, when I think of resilience, I think of this quote by Viktor Frankl. Between stimulus and response, there is a space, and in that space is our power to choose our response. And in our response lies our growth and our freedom. And really, it really is that sort of space, spending time to find that space, that is really important right now. So connect, renew, and refresh with whoever it is in your crew. Here is my crew, the Physician Moms in Family Medicine, but whoever is part of your crew, connect with them and spend time. And take inventory. What are you thankful for? Who you can connect with? Who can you connect with in your community? Who can you engage with? And what concrete steps will you take to build resilience this week? We can't alone change the world, but really can cast that stone across the water to create many ripples, right? Hopefully this is that moment where we cast these little ripples in our community that can change our world. And lastly, we know that we can't forget the patient. We know that they're at the center of our mission. Sometimes they drive us crazy, but at the end of the day, they are at the center of our mission. And so I wanted to close with that. And I do provide some information, my contact information, also some resources. But Dr. Delacruz, Dr. Dasarathy, any comments, questions?
Thank you so much, Dr. Yu. I so much of what you said rang true for me. What I kept hearing me say to your suggestions, your ideas, is that, but I'm not enough. I'm not enough. I'm not enough. I can't, how could I possibly do that? But then I realized through more of what you said was that I'm undercoding myself, just like we undercode and we underbill because we do it so much that we don't give it value. And to be able to print off the health resources, the community resources thing, and hand it to your patient, or to connect them with somebody specifically in those resources, or to share eggs with the community. That's food. We need food first, right?
Right.
That's enough. Wow.
That is enough. That is more than enough.
Right. So I really appreciate that. And the other thing that you said was share stories and do it and then tell it. Don't be afraid to tell it. And then the next thing you said was about filling a bucket and being a bucket filler. And I have to tell you, Dr. Yu, in 2013, you filled my bucket, and that's why I'm here.
No.
So it's kind of cool. I don't know if you remember that we were at NCCL, which was NCSC at the time, and I didn't know what I was doing. And I was running for office, and my speech went over. It was a great speech, but it went over, and you kicked me off the days, and that was fine. and there was a delay in the vote tabulation. And so you said, get back up here and finish telling your story. And the whole crowd clapped, and you clapped. It was just, wow, what a way to lift somebody up and encourage them to keep going. And I would just encourage everyone listening to lift somebody up and help them keep going.
Thank you so much for sharing that story. And I totally don't remember that at all. So
I think you were consumed.
Yes. Thank you so much for sharing that, because it really means a lot to me. So thank you so much.
Thank you so much, Dr. Yu. It was really inspiring. You're always inspiring. And I met you in NCCL too, first time when it was back in 2012. I think you were running for an NCCL NCCL convener. When I heard your talk, I was inspired. Really inspired. And that is the time I was thinking about, there are so much talent that I have to use it to advocate for the community. That was really inspiring. So, and also, I met not only you, as you said, connect with your community, connect with other physicians, who are on the same page, sharing the values. What we do every day-to-day life was really inspiring. And I was amazed and thrilled. It's not only me. Everyone is in the same boat. It was so, refreshing when I was there in the NCCL. So I think the main takeaway that, what you talk about is, connect with the community that you feel comfortable with. You get refreshed. That is the joy of practicing medicine. That is the joy of who we are, what we want to do. So that is really meaningful for me every day.
Yeah, 100%. I remember reading, about a physician who said that they actually try and get one extra line into their social history every time they see a patient. So they actually ask a specific question that is totally random in many ways. Like, people are like, why are you asking that? But then they find out extra information about that person's family. And that makes all the difference, because that's when you really have that bond and relationship really grows with your patients, right? And then you realize that you really do have a huge impact in your community. And I think of conferences like NCCL, like FMX, like all the ones that we love every single year, that we miss being in person too, right? But we can find those areas of being able to connect with the same physicians, whether you just get on a Zoom with the people that you knew from those meetings, or whether you engage in virtual meetings. I think it's exciting that we have this community. I'm so grateful to the Academy. I'm so grateful to OFP, to AFP for just creating this space for us, right? It's just awesome. So thank you again for having me here to talk with you and to share our story of family medicine. Thank you.
You have provided many takeaways we can use moving forward, Dr. Yu. So thank you so much for sharing all this valuable information. Thank you to our live viewers for listening in. For anyone that wasn't able to join in, this session will be recorded and shared on Wellness Week webpage, as well as the OAFP Facebook and YouTube pages. Finally, few quick reminders about the remainder of the week. Take part in Wellness Week Challenge to focus on physical activity and gratitude each day. If you submit your Wellness Week tracker by August 20th, you have the chance of winning the OAFP logo item. More info in your daily emails. If you're craving for some family physician pair time, join us virtual family medicine party hosted by the OAFP Foundation this Friday evening at 7 p.m. We are recognizing the Philanthropist of the Year and Mentor of the Year, as well as adding some friendly competition with Trivial. Registration is required, but free to attend. The annual members meeting is also this coming Sunday, August 15th. Join your peers to discuss academy business, install new leaders, and hear an AFP update. Registration is also required, but free to attend. And tomorrow's theme is personal health. We will have another live session at 4 p.m. with Dr. Cliff Knight discussing burnout and physician ecosystem. His presentation will cover a variety of topics from all themes this week. Joining Dr. Knight will also be two representatives from AFP to share information and resources available. Catch it live here on Facebook and YouTube. Hope you enjoy the rest of your Wednesday. Stay well, be well, and you are not alone. Thank you so much.